Hello, everyone. Welcome again to another edition of Cancer Watch, your trusted companion in understanding cancer treatment and survivorship. I am your host, Dr. Denise Ejo. Today, the hidden dangers of bone cancer. Together we fight, together we win. Tonight's episode is powered by Plus TV Africa. I'm proudly partnered with the Association of Radiation and Clinical Oncology of Nigeria, ACON. We're zooming in on a rare but serious disease, bone cancer. Though it makes up less than 1% of all cancer cases globally, bone cancer can change lives overnight. Together, we'll uncover the symptoms, treatment, and most importantly, the power of early detection. So joining me, as always, is my co-host, cancer advocate, and medical communicator, Dr. B. With me in the studio.
Hello, Dennis. Thank you so much, Dennis. As always, you're brilliant. Good evening, everyone. It's a joy to be here again to shed light on the cancer that we don't often hear about, but that we should. And we're honored to have in the studio with us today a brilliant media health champion and clinical oncologist, Dr. Sam Kwis, who is also the Chief Medical Director of the Kano Cancer Treatment Center, KCTC.
Thank you very much. Good evening, viewer. Thank you for having me on this cancer advocacy talk show.
Welcome. It's very nice to have you, Doc. And we're looking forward to this very interesting conversation.
And yes, indeed. Before we just dive into our conversation, let's quickly set the stage with a quick overview of what bone cancer is. Bone cancer actually refers to cancers that start in the bones and not cancers that spread from somewhere else to the bones. It's important to make that distinction. It's rare and affecting mainly the long bones of the arm, legs, or pelvis. And in Nigeria, though, we record over 120,000 new cancer cases every year. The exact data on the actual number of bone cancer is actually limited. So, still, what we know is this, that bone cancer strikes, and it strikes deep physically, emotionally, and financially. And alas, unfortunately, it also seems to have a propensity to occur in growing children. Because it's also so easy to overlook, we therefore have to talk about it, because together we fight and together we win. Let's start the conversation, everyone.
So sit back and let's go. Dr. Sam, is it okay for me to call you Dr. Sam throughout the thing? I think Dr. B calls it Dr. Kiss. Which one are we calling now?
Dr. Kwis. Yeah, Dr. Kwis.
Please, Dr. Sam, I'm sure he's fine with any. He's a laid back
anyone.
guru.
All right, let's begin this conversation. And so the first question is, and to be very honest, I'm interested in bone cancer, but we are on the metastatic side, so it's the other side. This is your side. I'm not very clear with it, so it's very interesting to see it, to understand bone cancer as a standalone, not as a metastatic disease. So let's look at it.
Yes.
What is bone cancer and how does it differ from other types of cancers? You see, I started off telling you about our own side.
Yes. Yeah.
Yes.
All right. So, bone cancers are cancers that originate from the bone cells. The bone, just like other body tissues, have cells from the cellular components to form the tissue and then the organ as it is. So, just like other cancers, it starts from a single cell that becomes denatured and become immortal and starts spreading. So that cancer cell that starts from the bone, that cancer that starts from the bone cell and then start invading other bone tissues, and then beyond, if nothing is done, is what we call bone cancer. Now, this is different from other cancers because Its uniqueness is the site of origin. So that's what makes it bone cancer. However, there are some cancers that can spread to the bone, especially breast cancer, lungs cancer, and then prostate cancer. These are cancers that has predilection for spread to the bones. So it's different entirely when you have a spread from a certain cancer to the bone, and then that originates from the bone. So that's what makes the difference. Its origin is from the bone cells, not coming from elsewhere into the bone. That's what makes the difference. Then, of course, in the laboratory, the cellular type, what the pathologist will see during histology studies will be cells that are characteristics of the origin. If, for example, it's from the breast and it spreads to the bone, it will visualize invasive adenocarcinoma cells in the bone instead of having cells that are originating from the bone, from the osteocytes, as we call them, the bone cells. So the origin is the key difference, and the cellular type is what makes it distinct from other cells.
Wow. Thank you, Chris. Yeah, that's brilliant, actually. Differentiating the primary bone cancers from secondaries, meaning the cancer came in from somewhere else. I think that really highlights it. And most of our focus today is the one that starts, like you explained, originally in the bone. So we refer to that as bone cancer. Thank you for simplifying that for us. Now, let's move on and let's ask you about what people would feel in their bodies, how they know there's something going on. What would be or what are the common symptoms of bone cancer, and how can people identify these symptoms early, Dr. Kwis?
All right, yes. So most cancer early symptoms you get is that of pain, and unexplained pain from that area or that site or the bone of origin. Now there are different bones in the body. So it could be the bones of the limbs, the lower or the upper limbs, or the skull bones or the vertebrae or whatever that area is. One of the early things patients present with will be pain on that area. Then the other thing that is also common is swelling, an unexplained swelling in that area, right? So the swelling from the bone will push the soft tissue or the skin. You see a skin over that site. There's a swelling that feels so deep into the bone. Is another very common sign. Then for some, it decrease in mobility because there's pain. You know, there's kind of like scared. They get scared to either move if it is on the limb or to move that hand or the leg that is involved. So their mobility is being restrained because of the pain. And then for others, there may just be an unexplained fracture. They did not fall, suddenly there's a fracture. And you know, when there's a fracture again, that also affects the mobility of the patient. So just because they can't change the bone now lose its brittle and then give way. Then there can also be an unexplained weight loss because in cancer there's a lot of metabolic activities going in, poor appetite and so on, fatigue, and then it results to weight loss. So for some, they just have an unexplained weight loss because of
Thank you, Dr. Chris. Dr. Sam.
uh,
When I'm
activities that are taking place, within.
thank you. When I'm listening to what you're saying, it's very interesting because I'm sure you know that I have cancer, and this bone thing is very key. It's very, very key because you don't understand. When you're just describing that, I started to check the bone in my legs. Now, that is just out of because I know I have the disease, and I'm more particular about this bone matter. And now, one is a metastatic, so understand it's not a straightforward one like those that have. But even when you are describing the symptoms, it's different because directly you can have a broken leg without knowing that why you got it, as against we that have had it and
Yes.
we're trying to find, and I know a lot of breast cancer patients who have metastasis of the bone.
Indeed.
I know quite a lot. A lot of my champions have it. And it's just very sad because we really don't know how to deal with it. And I recall, and I'm actually saying this because I recall 2 years ago when because of the pain in my bones, in my legs, I actually said I wasn't doing treatment anymore.
Yes.
Until I was able to palliative care. And now I take all the patches. I have all the patches. But it's because of the bone. It's not because of breast cancer. It's the bone.
Yeah.
Because from a point of sitting in it, and I know a lot of cancer patients that watch this program, I will not even realize this is going on. And some patients who already have this issue, I don't even realize that it might be cancer because they've had a broken bone and they don't know where it came from. So they just thought, just fix it and get back on track. Meanwhile, it's not necessarily the solution because that's not what. Anyway,
and if I could just quickly throw something in there, Dr. Kwis, I would like you to just quickly throw a bit of a light on the issue of a perceived antecedent injury, like a child has a fall like 2 weeks ago and then the leg starts hurting and everybody's thinking it's the fall that is responsible, but it's just sort of like a coincidence, and it's actually the bone cancer is just showing itself after some injury, and that makes people miss out that diagnosis. Doesn't this happen quite a bit in practice?
Yes. This happens a lot. In fact, some people, the first time you are diagnosing them of cancer is when they come down with, I just slipped and I have a fracture of this bone. That's when you now go start searching for other tumor markers. You see they are so raised and you begin to, this person that came with a fracture of the limb he just slipped and his PSA is so high, you check the prostate, you see, it was already cancerous and it has spread to other. So this happens a lot. And then for bone cancers, especially I'm sure we'll be talking about the type. There are certain types that are common in children. So in managing any child or any patient with a history of a fall, you should rule out other possible causes, not just that's it. By the time especially when the history of the fall is not so severe that will cause that kind of damage, then you should look beyond just fixing the bone. You should look at the possible cause. What are the mechanical activities that result to a bone? Bones on their own are very strong. So it has to take a lot of effort to break a bone.
Right.
Not just sleep and then have a fracture. It should tell you this bone, something is not okay. Yeah. So it needs to take some tissue from there to assess, to be sure that it's not just an ordinary fall. It's beyond that. Then we'll evaluate and treat the patient better.
Thank you. Okay, I think we're going to take a short break now. And when we come back, we'll continue this conversation with Dr. Sam. It's quite an interesting one because there is a lot of misconceptions where it concerns bone cancer and metastatic, and those that have throughout the original bone cancer and those that have had it because it's metastasized bone other places. But it's very interesting, and thank you, Dr. Sam. And to our viewers, sit back. We'll be back in a few minutes. Let's just take a quick break now. Thank you very much. See you soon. Thank you all for staying with us. It's quite an interesting conversation going on right here, and we hope that you are finding it very useful. So let's go straight to the next question. What is it now? And it goes, what are the treatment options based on what we've been talking about for bone cancer, and how can we prevent it? So those two are together. What are the options? And then how do we prevent this disease from coming up?
All right, so bone cancer, just like any other cancer, treatment involves a multidisciplinary modality where you have the oncologist, the orthopedic surgeon, the radiologist, the psychologist and psychiatrist, nutritionists, and all the team, the nursing care, and so on. So first of all, it's multidisciplinary because different persons may have different roles to play in managing the patient right from the diagnosis. So the importance also of a pathologist cannot be overemphasized because those are the ones that will eventually tell us if this is bone cancer or not. Now, the various treatment modalities available, the first and most efficient is surgery. If gotten very early, is best taken out completely via surgery. So surgery is one of the first and best options for treatment of bone cancers. For those that are not surgically amenable from the word go, then other treatment options can follow, such as chemotherapy, and then radiotherapy, and then targeted therapy using some molecular agents that can target certain cells, cellular types. So these are the various treatment modalities available for bone cancer.
Right. Thank you, Dr. Kwis. That's brilliant. So we know we have surgery. I'm going to ask you a question right now, which is, it's actually an important question, but I would also like you to slip in the role of limb amputations in management of bone cancer, because we need to talk about it as openly as possible so that people understand. So what my question is, what's the importance of early detection, which I believe one of them would be preventing fatalistic surgery, or rather excessive surgery? I don't know, you go ahead. So what's the importance of early detection and treatment in bone cancer, and how can it impact outcomes?
All right, yes. In the cancer space, we have this common saying that early detection saves lives. So early detection significantly improves treatment successes and even survival rates, when we catch these diseases very early. Early detection can also save us the pain of going through doing an amputation when we catch it when it's still very small. Remember, you mentioned amputation. And in the treatment, remember, I've also mentioned that we need psychologists, psychiatrists, because in the event the patient needs amputation, then you need to do a lot of psychotherapy to convince this person to accept that amputation. And like I said, most of the bone tumors, we catch them in young adults or young children. So imagine somebody at that stage of their life, you need to amputate them. So this is where the importance of early detection comes in. It may be able to help us to preserve function of those limbs by doing some surgeries that will just take out the tumor completely. So there's this likelihood to reduce the chances of metastasis also. So when we detect the tumors early, the chances that there will be metastasis in the future is very slim as compared to when it's detected very late. Even though it may look so local, there's a chance that one or two cells would have escaped already. So in prevention, the risk factors for bone cancers are generally not plenty, except for some genetical conditions like in Leishman syndrome. So prevention around lifestyle might be a bit minimal. However, generally speaking, persons that are exposed to tobacco smoking, so these are ways of preventing that, reducing pollution of the environment, especially for parents who smoke. Don't expose your children to secondary smokers in the environment. Have government to have designated smoking areas, and so on. Some persons that have been exposed to radiation by some other forms can also be a risk factor. So prevention of exposure to radiation. And some form of radiation can be the terrestrial radiation that you get from deep or radon gas that you get from deep holes. So for people that are in mining environment, so we want to discourage childhood miners to go to some towns. There's a lot of mining activity. You see children there. So they may be exposed to some form of underground radiation that could also pose a risk. So prevent them from getting exposed at those levels. And then for medical usage, ensure that the ALARA principle is being strictly observed so that we do as minimal damage in terms of the scatters that we have So radiation area ensures strict radiation control, for where there are medical use of radiation and so on. So we reduce those kind of exposures. Then leading a healthy life, less of refined diet, do more of greens and vegetables that have a lot of antioxidants that can help clear the system from some of those carcinogens that we take from the environment. Then of course going for screening where they are available. And then the moment you notice any of the symptoms that we have talked about, please do not waste time. Go see your doctor. So any pain, unexplained pain, please rush. It's a preventive measure so that we can even get it early. Any swelling around any bony prominence, please, let's quickly rush to see our doctor. Any fracture from minor faults is not just about see the specialist so that they will rule out other possible causes of that fracture. So by so doing, we'll be able to get it early and then manage it appropriately and reduce possibilities of doing very radical surgeries that might involve doing amputations and all whatnot. But of course, if it involves doing an amputation, like I always tell some of my patients, it's better you are cancer-free without one leg or without your breast than to have the two and then the cancer will just be there spreading and kill you.
Thank you, Dr. Sam. It's interesting because I actually do work with children who have been amputated, who have had amputations because childhood cancer children who are now adults. And it's interesting when I'm listening to you and thinking, wow, what are we going to do? It just made me remember I have to call one of them actually. But it's quite mind-opening. Okay, I'm not even going to go there because I'm very into childhood cancer children. I really have an interest in them. But let's go. I'm going to end this conversation. We're going to end. This is our last question for you. And the one thing that is very key for us is that it has to be very sharp because it's the last thing everybody's going to remember, whatever message you say right now. So as short as possible, targeted, what message would you like to convey to the public about bone cancer and how they can take an initiative in understanding and preventing it? So we want a sharp message that everybody will take away from this conversation right now.
Okay. Let's say what we are doing, awareness is really power, right? So bone cancer, though they are rare, they can be very serious. So recognizing the signs and then the symptoms is important, just like we have done in this conversation today. So please, let's pay attention and informed about these symptoms that we have talked about. In the event you notice any, do not waste much time. Present yourself to the hospital. So I also want to encourage regular checkups, especially for our children, and then teens for unexplained bone pain. That will also go a long way, in helping. Then have support cancer research and education groups. They're also very key. So this is some of the few take-home messages I really want us to. Let's pay attention to the signs and symptoms, and then a good health-seeking habit, what we need to develop. That will also help us to get them early and then be able to manage them appropriately. And finally, a diagnosis of cancer is not a death sentence. Like we have mentioned, there are treatment modalities. And then it's better to have one limb and be alive and healthy than to die with both limbs. Thank you.
Thank you.
Very well said, Dr. Kwis. Very well said. Thank you so much. At Cancer Watch, we've had a host of stories that haunt as well as stories that heal. In particular, we remember the story of 14-year-old Tomi, a bright girl from Akure, who thought her leg pain was just from falling during a play. And months later, she was diagnosed sadly with osteosarcoma. But thanks to the quick action and treatment that she got, she's now walking again and dreaming of becoming a nurse. So alive with one limb, far better than otherwise. Dennis?
That's what this is all about. Behind every statistic is a story, and behind every story is a chance to save another life.
We Yeah, tonight we've taken, everyone, thank you. We've taken a deeper look into cancer many never talk about because they just don't know, but it's one that truly and really matters. Bone cancers may be rare, but the impact they have is profound. It challenges strength, mobility, and identity, but with early action, it doesn't have to win.
And so let's take the message behind the walls of the hospital. Let it reach our classrooms, our marketplaces, our WhatsApp groups, our dining tables. Let someone watching tonight decide to take that persistent pain seriously, because that decision can be the difference between life and loss.
Yes, Dennis. Dr. Kwis, we would like to thank you deeply for shedding light on this complex, rare topic, but you did it with such clarity. And we'd like to thank our sponsors, Plus Television Africa, and our partner, the Association of Radiation and Clinical Oncologists of Nigeria, ACON. Thank you so much for standing with us in the fight against cancer. And to all of you who are watching from across Nigeria and beyond, whether you're a survivor, a caregiver, a health worker, or someone who just wants to understand, thank you for choosing awareness over silence, and we're deeply appreciative of you being there. We'd like to ask you to follow us and get involved. Please, let's keep the conversation going. Our various social media handles on Instagram at Comot Cancer Foundation, Facebook, Comot Cancer Foundation, YouTube, Comot Cancer Foundation Nigeria are all there, and our website, www.comotfoundation.org. Please share your story, repost this episode, send it to people who need to hear about it, and use the hashtag Together We Fight and Together we win.
Because being informed is better than not knowing. And so because when we're informed, we are empowered, and when we fight together, we win. Until next time on Cancer Watch, keep holding on to the light. Keep asking questions and keep choosing hope. We'll see you again next week, Friday at the same time, next week, Saturday at the same time, and looking forward to see you. And Dr. Chris, thank you. Dr. Sam, thank you for being with us today. Thank you for your time. And I know you're going back into clinic. Dr. B, enjoy your holiday.
Thank you.
Thank you, everybody. Goodbye.
Bye.
Goodbye.